Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment, I'm starting a new series on lupus erythematosus, systemic erythematosis, better known as lupus. From here forward, I'll refer to it as lupus. It's a very common problem. It affects usually women of childbearing age, and more black women are affected with lupus than white women. Even though every now and again, a young lady and adolescent age can also present with lupus, and occasionally men can develop lupus, but usually it's a woman mainly affected problem. And nobody really knows what is the really cause of lupus. It is an autoimmune, chronic inflammatory disease, very, very serious, can be very deadly. And in this country, there are 1.5 million people that are affected with lupus. Worldwide, about 5 million people are affected with lupus. And I'll give you the list of the risk factors for lupus. I borrowed this chapter from a massive book that I have coming out next year, more than 1,000 pages, but I thought I would bring you the latest. The most frequently affected problem as it's related in terms of risk factors, of course, is the race, age, sex, sunlight exposure, Epstein-Barr infection, smoking tobacco, and medication that can also cause lupus: ampicillin, isoniazid, procamidine, quinidine, metal-dopa, composine. All these can lead to lupus. And of course, as far as the organs that are affected most frequently with lupus, which is systemic disease, the skin, very common, the joints, kidneys, blood system, the heart, the lungs, the brain, the blood vessel, the hair, and the mouth can be affected with lupus. And the presentation can be extremely easy to figure out, sometimes extremely difficult. It is not unusual for a woman to present with, let's say, loss of hair is falling off, or one area of the hair has an empty hole because the hair is falling there. Some kind of eyebrow can be the first presentation. Somehow the eyebrow is falling off, etc. And of course, one of the most common presentation is a rash anywhere over the skin for no particular reason. A person can present with a rash, and you begin to evaluate the rash, and after you finish your evaluation, it turns out to be lupus. Somebody can present with shortness of breath because they have pulmonary problem, and then you begin the evaluation. After the workup is completed, it turns out to be the lung is affected by the lupus. Somebody might come in with chest pain, in particular a woman with chest pain of that particular age. You're evaluating them. It turns out that the chest pain is because they have pericarditis, and the pericarditis is causing the chest pain. And they might come in with inflammation in joints of different types of joint. And you begin evaluating the joint. And when I get to the evaluation, I'll tell you how to go about that. And the swelling, the pain, it turns out to be lupus. Frequently, a lady will present with no symptom except that she's anemic and the white blood cell count is low. Well, that's pretty tricky because you're dealing with mostly black women, as I mentioned earlier, and as the way God has it, most black folks has lower white count. Most black folks have lower white count than white folks. So you can't just take it and put it away, because that may be, in fact, yes, natural phenomenon. They have low weight count, but you must evaluate it every time before you file it away, because that may be the first presentation of lupus. They may have no other symptom other than the fact that the white count is low, and sometimes they present with unexplained anemia. So why the patient anemic, especially if they have childbearing age, which could be iron loss, but it may not be. Okay, so you can't just say, well, assume that it is because they have iron deficiency, because you cannot be a woman of childbearing age, i.e. menstruating female, and don't have iron deficiency. Regardless, across the board, all menstruating female have iron deficiency. Iron deficiency is not the same as iron deficiency anemia. Sometimes they have both. Frequently, they have both the iron deficiency and the iron deficiency anemia. Yes, they can have both, but sometimes they're not anemic when you look at it, but yet the iron is very low. And I'll tell you how you go about evaluating that process. What's the difference between iron deficiency anemia and iron deficiency? I'll tell you all that, how you go about figuring that out. I mentioned before the present with a joint. Well, the joint, there are so many things that can someone to have pain in the joint, swelling in the joint. I mean, the list is extremely long. But based on the age of the, in this case, the individual, i.e. possibly the woman, you have got to think on top of the list. You're going to think of lupus, you're going to think about rheumatoid arthritis, you're going to think of a whole lot of stuff. And it is not that difficult at all if one understands medicine the way you're supposed to, how you differentiate between rheumatoid arthritis and lupus, or osteoarthritis and lupus, etc., etc. Not that difficult. You just have got to know the key. As I mentioned many times, and I'll mention it again in this series, for every single lock that I ever existed, that exists, there is always a key. If you understand the concept, you don't have to be wasting time and money doing a whole lot of unnecessary tests. If it is lupus that you suspect that causing the individual to have the swelling of the joint, it is not that difficult to differentiate. You just simply have to know what to do and when to do it, how quickly to do it, and then you could eliminate lupus right there and then consider something else. Okay, now the blood system is not only affected because the white blood cell might be low, it could be anemia as well. It could be the platelet count, or a combination of all three, white blood cell and red blood cell and platelet pancytopenia. All three can be low just because of lupus. All right, so you have got to understand the process. Fever. Somebody comes in with fever. We try to explain the fever. The fever is intermittent. You would like, the first thing you would do clearly to rule out an infection. Is it a bacterial infection? Is it a viral infection? Is it a fungus infection? Now in the middle of the COVID-19 pandemic, the first thing one will rule out is the patient have COVID-19. That has to be on, that nowadays has to be right on top of the list. And you have to quickly try to get the test done. The quickest way to get the test done these days, because it's so difficult to get a test done, is to get the patient to the emergency room. You have every right to get this patient to the emergency room, because in the emergency room, there's a complete section that is left aside just for COVID. Doesn't matter whether the patient had the fever or not. Once you present the emergency room, in order to process you to know what's going on, they're going to do the COVID. Okay, and it is extremely complicated. The quickest test, of course, is to do the nasal swab, but the nasal swab has up to 25 to 30% false negative. And if you use your judgment, then you will do the antibody test at the same time, because again, you can't practice. It goes without saying, you really cannot practice medicine to any degree of quality if you don't have, number one, knowledge, number two, experience, and number three, judgment. Those are the three things that you need, no matter what anybody tells you. And roughly 70 to 75% of what practicing physicians do every day is based on judgment, as important, crucial as the knowledge is, as the experience is. But it means nothing if you don't have judgment. You could be the smartest person in the world, and you put at the bedside to treat patients, you're lost. Totally, completely lost. And I have seen that. I have seen that. That is why we go to medical school. There's a whole group of folks that wind up doing research after they graduate, after they finish their training, because they know they're not clinically oriented. They are folks that's not as smart as these people, and yet they become much better physicians at the bedside because they have judgment. And judgment takes second. When you have people that are extremely sick, absolutely extremely sick, and you have got to have judgment. I'm not here to release or reveal confidential information, but it isn't that long ago, days or weeks ago, that I faced a major problem. I mean, extraordinary problem at a hospital not too far from here in White Plains. Couldn't figure out what was going on. And using my judgment, I decided, why don't I do an MRI of this individual shoulder? After spending thousands of dollars doing this, doing that. And guess what? That individual have a big torn ligament in the shoulder with absolutely no trauma. Just lying in bed. Okay? I mean, that's when judgment comes in. And that solved the problem right there. That's what the problem was. Okay? How about that? Okay? So, it is crucial to have knowledge, but the knowledge is useless if you don't know when and how to use it. It is not going to benefit the patient. Absolutely. You could stand up and give big lectures and people clap their hand and praise you and you feel good, blah, 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 blah. But when you're at the bedside, you're totally lost. It's when you can do all together in one basket. That's when you are allowed, you should be allowed, to turn loose on your own to practice high-power clinical medicine. That is my judgment, my concept. There are a whole lot of folks out there that are fantastic doctors, great doctors, but a whole bunch that really should not be allowed to practice medicine without supervision. Never. I don't care how many years they've been at it. They're just simply not good enough. You could tell them I said that. I couldn't care less, okay? Because this is the truth. I've been a patient myself. 3 separate times. There are 3 separate cancer. And each time, my cancer was missed. Each time, I had to diagnose it myself. How about that? And if I didn't have judgment of all the stuff that I'm doing every day for everybody else, I would have been dead a long time ago. Each separate time. Each 3 separate cancer. Each separate time, my cancer was misdiagnosed. And each separate time, I disagree. I say, no, something is not right. And I took over. Took the pad out of my pocket. That's right. The law says I can do that. Took the pad out of my pocket, wrote my own prescription, and proved that I had cancer. How about that? So, I'm a patient advocate, yes. And I'm not going to have to make excuse for that. I'm giving you an example. That is not to say you don't have extraordinary, brilliant, capable physicians all over the place. You have to understand, 70% of medicine that is practiced in this country is practiced in the community. So it is a given that you have brilliant, capable, committed physicians throughout the world saving lives as I speak. Okay? But unfortunately, crazy things does happen, and I and I've experienced it, okay? I believe you can't make this up. I was told on a Monday that I had no cancer. On Tuesday morning, I disagree. On Tuesday morning, I took out my prescription pad and wrote a prescription for a PET scan on my own, PET scan, at a hospital that I will not name. By Tuesday afternoon, it was proved that yes, Val, you're right, you have cancer. And Wednesday morning, I was at Memorial in the city. How about that, okay? And the cancer was already stage 2. And I was told I had no cancer. So when I speak, I'm not bragging. I'm just telling facts. I have experienced it, okay? I was telling one of my colleagues earlier today, 3 times, I was given the final, whatever you call that, when you're going to die, by a priest. A priest that was really right here at St. Bernard. That priest came. Nice priest. Final right, 3 times. I said, okay, guess what? I signed myself out of the hospital, went home, and took care of myself. Became my own doctor, as I am my own doctor today. And guess what? Almost 20 years later, I'm here talking to you. And if I didn't have the knowledge, I wouldn't be here, okay? I would have believed what was told to me. And there are people that have every right to believe. You have brilliant doctors that are out there that are telling them the truth. In my case, I was not fortunate. But thank God I had brain power. And that's why I can sit here, couldn't care less what everybody can say. I'm talking to you, okay? Because that's the reality of it. So getting back to lupus then, so I talk about the joint. Now let's talk about the kidneys. Oh my goodness, the kidneys are crucial. For everyone that is not clear, everybody with lupus, of all the things that can happen to them, the organ that can be damaged the quickest if things are not done the right way happens to be the kidney. That is why if you have a female patient of childbearing age who have lupus, you have to plead with them, because you can't put them on birth control tool because it is contraindicated, to plead with them not to get pregnant. As soon as they get pregnant, within days, the lupus decompensates. Why, nobody knows. And the organ that gets shut down the quickest when that happens, quite frequently, is the kidney. Nobody knows why that happened. But acute kidney failure occurs so fast, so quick, in an individual with lupus. And you have to plead with them. You can't force them to do anything. You have to plead with them. Try to do some procedure of some kind to prevent pregnancy. Because they could be doing along very nicely, getting better, moving along nicely. Bango, they get pregnant, bango, they lose it, and that's it, and they're finito, okay? So you got to be careful, okay? You got to be careful. So I thought about the brain. I thought about the heart. I mentioned the lungs. Well, a lot of stuff can happen to the lungs, okay, when you have lupus. You could have more frequent pneumonia. You could have clots into the lung, because that people with lupus has an increased incidence of DVTs, deep vein thrombophlebitis, which can dislodge and go right into the lung, and just like that. If you missed it, or if it's located in the wrong way, you could lose the patient in 5 seconds. So you got to, when you're following an individual, your eyes has to come wide open. There's no organ that you can't not have in the front of your forehead every time when you see the patient, when the patient calls. So the lungs are crucial, okay, absolutely crucial. And the patient may have heart attack, run into heart failure, which will affect the lung. They can't breathe because they have fluid in the lungs, okay? Now the next organ that you got to talk about is the brain. The brain gets affected extremely frequently with stroke in particular. Stroke in particular, extremely common, no matter how young the individual is, they can have problem with the brain because of stroke. Those are complicated mechanism. As I said, I have this massive book coming out next year. I already copyrighted, so I can talk about it. All this stuff, the mechanism why all these things happen, will be discussed fully. And this is the chapter. It's a big chapter. It's all on lupus, and this is from that book. I copied it. I borrowed it from that book because it's all up to date. The book is coming out. It's already copyrighted. That's going to be the 2021 book. So now you know there's a book coming out. Okay. Now let's talk about the blood vessels. Oh my God, the blood vessel, vasculitis, which is an inflammation, cellulitis, clot inside the vessels, as I just mentioned. All these things have to be in front of your forehead every time you're dealing with a patient with lupus. The blood vessel get affected frequently, and if the patient lives long enough, then the blood vessel will have plaques. You can't have lupus and live long enough and don't wind up with plaques in your arterial vessel. Why? Because then it's an inflammatory, chronic inflammatory disease. As the inflammatory material get dislodged, they are circulating into the bloodstream. It's inevitable. Some of them are going to get stuck to the blood vessel. Once they get stuck to the arterial vessel right there, that's a nidus, we call that. The first inflammatory material get deposited, that's a nidus. Once you have that one nidus, that causes a local inflammation to occur itself inside vessel, wherever it is deposited right there. That damages the vessel by itself. And then because the vessel is no longer smooth, as blood is passing through, more inflammatory material is going to get piled up on top of another. And then the local inflammation where that thing first deposited is going to cause plaque to develop. You cannot have chronic local inflammation occurring in an arterial vessel without subsequently develop clot. No matter how young the individual, they're going to wind up with occlusive disease in the arterial in the high flow system, the arterial flow. So you have to always be on the lookout for that. And then I mentioned the heart. What I forgot to mention, one of the most common problems associated with the heart in an individual with lupus is damage to electrical system of the heart. They wind up with heart block. No matter how young they are, they may wind up with heart block needing a pacemaker. So you always have to be looking out for the symptom. They feel dizzy. What is the dizziness? Is the dizziness due to something else in the brain, or it has to do with the heart? You got to do your EKG. You have to do your echocardiogram. You have to do a 24-hour Holter to make sure that you're not dealing with heart block. Because the patient can collapse in the street, can collapse while they're driving. I don't mean to scare you, but I explained to you, this is a very, very bad disease. And it is extremely common. 1.5 million people in this 1.25 million people in this country, and so 5 million people worldwide suffer from lupus. And these people, it's a chronic problem. It is a hard, heavy-duty load of work you have to do to keep this individual going. And there's another condition, okay, called lupus anticoagulant, whereby when you do your blood test and somebody who has lupus, again, I'll be talking about these things, but so many students and physicians, etc., listen to this show, because somebody with lupus, as you're evaluating them, as we often do thoroughly, you come up with an elevated partial thromboplastin time. That not necessarily means they have a bleeding problem. The contrary, they have a clotting problem. That's why lupus anticoagulant is very common in people with lupus, but it's not a bleeding problem. So just because you see an elevated PTT, you shouldn't go wacko trying to think that they're bleeding. They may be clotting. And once you see that, then you could go back to the brain to find out they may have microvascular disease of the brain, little tiny stroke throughout. And then you got to understand, you must set up right there, step up, begin to, you have to anticoagulate them. How about that? The PTT is high, but it's not due to a bleeding problem. It's due to a clotting problem. And if you don't understand that, then you lose a lot of time to try to think the patient has a bleeding problem when the patient does not. Okay? I remember years ago, what do I care? I'll tell the story. I was a big time chat reviewer in the very beginning of the AIDS epidemic. Patient was on the OR, being treated, being intubated. And then this surgeon, who doesn't know anything about hematology, go through the chart, see this patient have elevated PTT. Instead of canceling the surgery, let's get reevaluated. This guy went ahead and infused plasma into this patient to try to carry on the surgery if I thought it was a bleeding problem he's trying to correct. Guess what? He was 100% wrong. The patient had lupus anticoagulant, and he exposed this patient to the possibility of catching AIDS. This was in the beginning of the epidemic. I was so sick to my stomach when I reviewed that chart. It was disgusting. That's why they don't like me, because I have this knowledge and I tell the truth. I could not believe this was done. It was done. I know. I reviewed the chart. As disgusting and awful it is, this was in fact done so that they can make money, rush to the surgery. Turns out when evaluation was done, because I recommended the evaluation, I demanded an evaluation, the patient in fact had lupus anticoagulant. Nothing to do with a bleeding problem. It was a clotting problem. And this poor patient was exposed to plasma. This is the time when it was the very beginning of the AIDS epidemic was going crazy. They didn't even know what to do. And this poor patient was exposed to that, okay? So this is serious business, okay? I'm not perfect. This is not bad-mouthing anybody. This is telling you things that I have seen after 47 years. You have no idea the stuff that I have seen. I have plenty of show to do on lupus, but I want to remind you one more time. The pandemic of the COVID-19 is real. Wear your mask. Put a glove to go to the supermarket. Keep your distance, 6-foot distances. Wash your hand with soap for 20 minutes and use hand sanitizer. Listen, until I see you again, this is Dr. Alcena saying so long and bye-bye.